Northern Vietnamese Survivors of the Vietnam War by Angelina Lazier, Donna Erdman, and Janice Rogers. We decided to focus on the trauma that Northern Vietnamese survivors of the Vietnam War were exposed to and the after effects. We chose this topic because it isn't very common that there is a conversation about the Vietnamese soldiers when talking about the Vietnam War. We tend to focus on the history, American veterans, and the consequences that came afterwards here in our country. Also, considering that this war was fought on Vietnamese soil, we were interested in knowing how that affected people versus the Americans that didn't witness combat in their own country. The article itself also stated that understanding of how exposure to war influences health derives almost exclusively from research among American veterans of 20th century wars. The Vietnam War was endured for roughly 20 years, from 1965 to 1975. It is estimated that 1 to 4 million Vietnamese soldiers and civilians were killed during this time. According to military records, there were around 58,220 American military deaths. To put it into perspective, Vietnam had 100 times more casualties than America. Draft laws in Vietnam made serving in the Vietnam People's Army nearly universal for most young men from the 1960s to the 1980s. Women also served in paramilitary support, such as the Youth Shock Brigades, oftentimes including combat participation. Elderly North Vietnamese people spent their young adulthood in constant conflict. With the U.S.'s expansive bombing, it was inescapable. Whether they were soldiers engaging in combat or civilians witnessing wartime traumas, they were directly exposed for 20 years. Trauma exposure for civilians included the death of friends and family, taking care of the injured, becoming injured themselves, witnessing deaths of men, women, and children, and being exposed to Agent Orange and other toxic substances. Soldiers experienced the general stressors of being in combat. They often had long deployments with no breaks, which limited the contact they had with friends, family, and community support. Soldiers also suffered from minor to serious injuries, including ruptured eardrums due to harmful sounds from gun and equipment, infectious diseases such as tuberculosis and malaria, and exposure to toxic substances such as Agent Orange. Agent Orange was used by the U.S. to eliminate forest coverage for Vietnamese troops. Agent Orange also eliminated crops that might have been used to feed them. Most importantly, soldiers were exposed to killing opposing forces. Our article examined both veteran and non-veteran Vietnamese survivors in older adulthood and the intensity of health effects due to wartime trauma. Our article was composed of 3 hypotheses, but for the purpose of this assignment, we decided to focus on only one, which was exposure to wartime traumatic events would be a significant determinant of health status among Northern Vietnamese older adults. Data from the Vietnam Health and Aging Pilot Study, otherwise known as VHAPS, that was done in 2010 was analyzed. VHAPS explored the health and well-being of Vietnamese men and women who entered early adulthood during the Vietnam War and who were entering late adulthood then, in 2010. Respondents included almost precisely half men and half women at around 67 years old. Their survey provided information for creating a visual for life courses, measures of military service, trauma exposure, current measures of health, and demographic and socioeconomic characteristics. The study consisted of a survey that asked the participants if they experienced the following: being a civilian in the war zone, witnessing mass killings or atrocities, unexpected death of a loved one due to the war, exposure to combat, being exposed to toxic substances, and/or killing or seriously injuring another person. Witnessing wartime traumas appeared to be the norm amongst all respondents. Other stressors were accounted for aside from the survey questions. During the Vietnam War, spousal separation occurred in approximately 1/4 of participants and approximately 1/2 of veterans. Unemployment, job loss, and financial debt were also common. Some soldiers began picking up drinking or smoking cigarettes as a way to cope with stress. Physical disabilities that limited daily functioning, as well as lack of social support, catalyzed depressive symptoms. So what was found? In terms of physical health, participants who reported having killed or seriously wounded another had significantly poorer health than others. They also reported more numerous and severe somatic and chronic health complaints, such as hypertension, heart disease, lung disease, and arthritis. Having social support correlated to having somewhat of a better health outcome. Overall, those that reported intense and severe wartime trauma, most importantly, killing another person and exposure to Agent Orange, associated with having poor physical health in older adulthood. In terms of mental health, participants reported that killing or seriously injuring another did not cause them great or even moderate stress. In fact, many veterans claim that killing in war is an act of duty, patriotism, and self-defense, and in this study, 1/3 reported killing or seriously injuring another person. Overall, it appeared that there is a lack of correlation between trauma exposure and mental health issues, such as depression and PTSD, in Vietnamese war veterans and civilians. For the purpose of this study, it is important to remember that mental illness has a major stigma in Vietnamese culture and that it is not expressed often or freely. It is also important to remember that the lasting psychological and physical pains of war might be experienced in culturally different ways.